again, everyone, and welcome to Utopia. Today we bring you two stories that we hope will inspire you to take part. Take part in the exploring, take part in the learning, and take part in the political process that protects these places. Our feature story today will focus on the health of those living in Salt Lake City, Provo, and Ogden. Hear what one of the premier physicians in Utah says is happening to your body as you breathe in the pollutants that fill our air. And later in the show, we'll be clearing the air as we float into the labyrinth on the Green River into Canyonlands National Park on a 4-day river trip, immersing ourselves in red rock wilderness. There are many ways to explore the vast landscapes unique to Utah. Floating has to be one of the most relaxing. That's later in the show. But first, our feature story. When Utahns are polled about their major concerns on the environment, the top 3 answers always include air quality. Today we will talk with Dr. Robert Payne, a lung specialist from the University of Utah. Here's Patricia Matson with a story about what the air is doing to our bodies and how you may minimize the dangers of air pollution.
When you breathe bad air, the result is bad health. They may say you are what you eat, but it's just as important to remember you are what you breathe.
It started when he was about 18 months old. He was first hospitalized. He was hospitalized with RSV, and from there he was hospitalized about every 6 months for 2 years.
We have clear certainty that air pollution contributes to heart attacks. We have clear certainty that air pollution contributes to pneumonia, to exacerbations of asthma, to the development of asthma. I also believe we have confidence that air pollution contributes to aging of the brain and to strokes.
Dr. Robert Payne is a physician in the pulmonary division of the University of Utah. He is a lung researcher and director of the university's program for Air Quality Health and Society and is also a member of the nonprofit group Utah Physicians for a Healthy Environment.
Utah Physicians for a Healthy Environment has a goal of improving health through improving air quality in our state. We want to do that by helping citizens and policymakers understand why we need to improve air quality, what the consequences are of not improving air quality, and if we can make changes that lead to improved air quality, we'll improve health across the state.
Across the nation, 4 out of 10 Americans have unhealthy air in their communities. If you live in the Salt Lake Provo metro area, that number is 10 out of 10.
Day to day in my practice, I see patients who have lung disease, such as asthma, smoking-related lung disease like emphysema, or kids with cystic fibrosis. And these people will come in and tell us, yes, that they have worse symptoms when we have our inversions and poor air quality. They'll have problems with wheezing and cough, shortness of breath. We also know that if people have pre-existing lung disease, one of these common problems, that they're more likely to need visits to the emergency room. They're more likely to need hospitalization when they've been exposed to poor air quality.
Air pollution is a general term that applies to any chemical, physical, or biological agent that changes the natural components of the atmosphere. The World Health Organization estimates that 4.6 million people die each year from causes directly attributable to air pollution.
Now, nationally, there's lots of data that says that when people are exposed to higher levels of air pollution, they're more likely to have heart attacks, they're more likely to die of lung disease, of heart disease, more strokes, and they may even have more rapid decline in their intellectual function as they age, and they don't think as well over time.
More deaths per year are linked to air pollution than to automobile accidents, and everyone who breathes is at risk. Even if you feel healthy now, the long-term effects are growing and festering.
So there are certain populations that are particularly vulnerable to problems with air pollution. The elderly clearly have great risk, but we need to remember kids, especially because the kids can't vote and don't speak up for themselves. We know that kids who grow up in more polluted environment, their lungs don't grow as big. There's a nice study looking at California college football players and where they grew up and what their lung function was like when they got there. And the more polluted the environment where they grew up, the less their lungs grow and the lower their lung capacity overall.
While scientific studies of air pollution and health are important, most locals already have the empirical evidence. The proof that bad air quality is bad for a child's health is obvious to parents around Salt Lake City because they see it in their neighbors and they see it in their own children.
It's a personal issue for me. It's hard to see your child struggle to breathe when everyone breathes and takes that for granted most of the time, because everyone can do it easily.
Amber and her family live in Roy, just north of Salt Lake City. Her son, Ridge, is a healthy 5-year-old boy, if you don't count the lung problems he's been facing since he was a baby. Amber notices that on bad air days, Ridge has substantially more difficulty breathing.
I have people come in and their complaint to me is often that they can't breathe. And I have people who come in and say, I know I don't have to watch the weather. I know what the air quality is because my breathing is worse. And I have people who say, I can't go outside because the air quality is poor. I can't exercise. I can't do the things I want to do. And it's a terrible problem.
The truth is, air quality is better in the Salt Lake City area today than it was 30 years ago. But we are still ranked in the bottom 10 cities in the United States for short-term particle pollution. And don't let the phrase short-term fool you, because particle pollution is a very harmful type of pollution for lungs and brains, especially when those organs are still developing.
Stay tuned. When we come back, how to minimize your exposure to bad air.